Hello and welcome to another Top Doctors online interview where we speak to one of our leading specialists. Today we're very fortunate to be joined by leading consultant psychiatrist Dr. Leigh Neal to speak about transcranial magnetic stimulation, often abbreviated to TMS, and its applications in the treatment of depression. So welcome, Dr. Neal. Thank you very much for joining us today. Would you like to introduce yourself and tell us a little bit about your background and your areas of expertise?
Yeah, well, I qualified in medicine in 1981, quite some time ago, and then I trained as a GP to start with and worked as a GP in the armed forces for about 6 years, and then changed over to psychiatry and then trained as a psychiatrist and then worked as a consultant psychiatrist in the RAF. So initially I became an expert in PTSD, and that was my sort of area of interest and publications, etc. But I've always had an interest in biological psychiatry and been aware that historically the biggest changes that have occurred in psychiatry over the years have been due to new interventions with biological treatment. So if you look at ECT in the 1930s and then the development of antibiotics in the 1940s with general paralysis of the insane, and then the development of antipsychotics and antidepressants in the 1950s and 1960s. These have had the biggest changes in terms of moving people from institutional care and into the community. And so I was very interested when transcranial magnetic stimulation became available. And in fact, it was invented in Sheffield in the UK in the 1990s before it became really sort of tested on a research basis in the United States. And I got interested in this about 10 years ago and went to Maastricht University and was trained in the use of TMS there. And then brought the ideas back, and then with a colleagues set up a company called Smart TMS, and we've been treating people with transcranial magnetic stimulation for the past 8 years. And we've now treated well over 1,000 patients and developed a great deal of expertise actually in the treatment of different conditions with TMS. So we treat depression, OCD, cocaine addiction, as well as a number of other conditions. Yeah, so that's the route to where we're at the present time.
Thank you very much, Dr. Neal. We're really looking forward to hearing your expert insight on this topic. So as I mentioned, we're going to be talking about transcranial magnetic stimulation in terms of treatment of depression. And that is a treatment for depression that many of our listeners may not, in fact, know anything about. So to start off, could you tell us a bit about how TMS works as a treatment for depression?
Well, TMS basically works, it's a magnet which produces pulsing electromagnetic waves, which then pass into the brain, which then stimulate electrical activity on the surface of the brain. And depending upon what type of coil you use, you can either focus the electrical activity to a single area, about a sort of centimetre squared, or to a wider area. We use more focal treatment with our TMS. We use what's called a figure-of-8 coil, which focuses the electrical charge to a very small part of the area in the brain. So you can basically stimulate the surface of the brain over the whole of the surface, depending on where you put the magnet. You can also, there are also different frequencies, so they're either high frequencies or low frequencies, which causes either suppression or activation of the brain. And that's the way it works. Yeah, in principle. In terms of what we know, what happens within the brain, we know that it stimulates the production of neurotransmitters. Not only in the region where you do the stimulation, but also deep inside the brain. It also causes the proliferation of neurons, so you get more connections. And then on a slightly larger scale, it improves functional connectivity. So we know that with patients who have depression, they have certain functional connectivity abnormalities between various parts of the brain. And the application of TMS can actually correct those functional abnormalities. So, and these findings are based on MRI studies on people that are treated with TMS. So we have a good sort of biological sense about how it works. So when we're treating depression, we treat. I don't know if you can see this model of the head here. I'll just lift this up. I don't know. Is that in focus?
Mm-hmm.
Yeah. So we tend to treat with high frequency over the left side of the brain, about there, and so the person will feel a very high frequency pulse at about 10 hertz for a period of about 20 minutes. And that's the process.
Okay, thank you, Dr. Neal. Really interesting. A really important question, though, for people at home will be about potential side effects and risks associated with this type of treatment. Could you tell us a bit about that?
Well, the most serious potential side effect is a convulsion. So, convulsions have been recorded with TMS in the past, but it's a very rare occurrence. It's supposed to occur in about 1 in 50,000 applications. But as I said, we've treated well over 1,000 patients, and we've never had a convulsion. I think if it's administered carefully and within the parameters that the machine is designed for, it shouldn't occur. If a convulsion does occur, they're usually very brief. It's treated fairly easily, and it doesn't lead to the person having a higher risk of convulsions in the future. So that's the worst symptom. More minor side effects, which are probably a bit more common. So, well, a lot more common. Probably in about 25% of cases, people can get some slight discomfort over the area where the magnet's applied. Some people can get headaches afterwards, which are usually transient and paired up with analgesics. Other less common side effects, fatigue, dizziness, but these are all transient and all pass off. So in terms of the side effect burden, they're much less than you would get with antidepressant medication.
Thank you. That's very reassuring, Dr. Neal. So let's move on now to talk about effectiveness. Exactly how effective can TMS be in treating depression, and how does this compare to more traditional antidepressant medications?
Well, when a patient first presents with depression, you would normally treat them with a psychological treatment such as CBT, and then maybe move on to antidepressants with or without CBT. And generally, most people presenting with the first episode of depression, around about 60% of them will be treated effectively with that form of treatment. And those are the nice recommended treatments. So TMS is really recommended for patients with resistant depression, which means they haven't responded to that treatment with CBT or antidepressants. So we're really applying the TMS to that group of patients who haven't responded to other forms of treatment. That doesn't mean to say patients can't have treatment with TMS as a first-line treatment, and in fact, that's probably becoming a more popular option now. But the data which we have in terms of the effectiveness is based on the treatment-resistant population. So we've recently conducted an audit where we looked at about 400 patients that we treated with depression. And in those that had over 20 sessions, the remission rate was 55%. So you could expect of those with resistant depression, just over half are likely to recover with the application of TMS.
Okay, so it's clear there are some excellent benefits. Are all people with depression suitable for this type of treatment?
Well, round about 25% of people that we treat don't have any benefit at all. So people aren't made worse with TMS, but there's a proportion of patients who have absolutely no response. So they don't show even a flicker of improvement. So what we don't know what the factors are which would predict those patients or allow us to predict in advance the patients that aren't going to respond. There's a huge amount of research on this, looking at all sorts of different things to try and find predictive factors. But none of them have been applicable in the clinic yet. So we generally will give people round about 15 sessions first to see if they're going to respond. And we can tell by their response at that point if they're likely to be a responder or not. So we can reduce the number of sessions they need to have to find out they're not going to respond. Around about 75% show some response. And as I said before, 55% go into complete remission. And about 25 to 30% have a complete abolition of symptoms. So they have like 100% cure.
Thank you, Dr. Neal. Some really encouraging statistics there. So let's talk now about a typical treatment path with TMS. What does that look like, and how many sessions are recommended for optimal outcomes in treating depression?
Yeah, so the treatment path would be that someone either refers themselves or they're referred by their GP or psychiatrist. It's usually someone who's already tried other forms of treatment and it hasn't been effective. Often these patients have had long histories of depression, actually, and they've had sort of recurrent depression over their life. And so they're looking for something new to try. So they'll have a clinical assessment with one of our clinicians, and they'll be referred to one of our clinics, and we have about 8 or 9 clinics spread throughout the UK in the main population centres. And they can have a familiarisation visit, so they can visit the clinic first to see what TMS looks like, what the machine looks like. Then they would start their treatment, and the treatment sessions, as I said before, usually last about 20 minutes. So it's a half an hour clinic visit. They're able to drive and work afterwards, so the TMS treatment doesn't cause any disturbance to their normal daily life. We now know that you can have what's called accelerated TMS. So, for example, if you could attend once a week and have one session per day across the first week, so that would be 5 sessions in a week, or you can have 5 sessions on one day. So you'd have the sessions and you'd have a gap of about half an hour between each session. And we now know that that form of treatment is just as effective as if you spread them out throughout the week. We know from research that the best outcomes are with people that have 30 or more sessions. So the person would be expected to attend either for 6 weeks, having a session once a day, having 5 sessions per week, or they would. You could, for example, have all those sessions concertinaed into 1 week. Obviously it's quite taxing to have 5 or 6 sessions of TMS per day, but it is possible for people who want to have rapid treatment or who find it more convenient. So that would be the treatment path. And then, at the end of the 30 sessions, you'd expect over half to be in complete remission and about a third to have complete abolition of their symptoms.
Excellent. Thank you, Dr. Neal. So some other important questions that I'm sure people who are listening will have about what TMS actually feels like. So is it painful? How long does the session last? And how do patients prepare for it?
TMS has a peculiar feeling, which it's hard to convey to someone who hasn't experienced it. So we always like all our treating clinicians and our TMS practitioners to actually experience what TMS feels like, because I think it's important to understand what the patient's going through. And it has a kind of peculiar sort of electrical effect, which can be a little bit disconcerting at first, but people rapidly acclimatise to it. And so, although they might find the first session a little bit unusual feeling, usually by the 3rd session they're completely acclimatized to it, and people can read and do other things while they're actually having the TMS. So it's really the fact that it's a funny, unusual feeling rather than that it's actually true discomfort. And once you've acclimatized to this odd feeling, you can usually continue with the full treatment package. And we don't have any patients that drop out because of the experience of the way it feels.
That's really reassuring. Thank you, Dr. Neal. So just to close up, a final question. Could you talk about the long-term impact of TMS treatment for depression?
Yeah. So I think it's important to know that, as with all forms of treatment for depression, I'm just going to talk about the short-term impact first of all. So you have the course of treatment, and you're one of the people that go into remission. There's still a risk of relapse in the next 12 months, and the highest risk is in the earlier months. And we know from studies that the relapse rates after TMS are about 40%. So we provide what's called continuous care TMS, where people can attend once a month, and they have 1 session a month. And we find that keeps the TMS at bay. And if they do start to show early signs of relapse, we can increase the frequency, and then that will stop the relapse. So with a continuous care approach, you can actually keep people in remission. But that tends to occur with all forms of treatment for depression. So, for example, if you have antidepressant treatment and you've got resistant depression, the relapse rates are still about 60%. So that's not unusual. In terms of the long-term effects for depression, well, that's good. In an individual sense, that's going to depend on the person's personal likelihood of relapse, and that varies from individual to individual. In terms of its effect on society, we're finding the uptake of TMS is quite low. There are some early adopter NHS trusts that are trying to set up services, but they're finding it quite difficult. Some of them set services up and then they're not continued because the psychiatrist that set it up moves on and it's not continued by the trust. There's no general policy by the NHS to introduce TMS. There are a small number of private providers such as Smart TMS, but as things are shaping up in the UK at the moment, unless there's a change of heart in the NHS to provide it more systematically, I don't think it's going to make that much difference to the population as a whole. Although, of course, if it was adopted and there was a policy, I think it would have a huge effect on improving mental health generally.
Thank you so much, Dr. Neal, for joining us today. It's been really, really interesting to hear your expert insight. If anybody listening thinks they might be able to benefit from treatment with TMS, you can schedule an appointment at one of Smart TMS UK clinics by visiting us at topdoctors.co.uk. Many thanks again, Dr. Neal, for joining us today.
Thank you very much.
Thank you.